PhD student in the division, and it is my pleasure to introduce to us today Dr. Ted Locke. Ted Locke is the George and Cynthia Mitchell Professor in Sustainable Development at Rice University. He holds an MS in Mathematics and a PhD in Economics from the University of Minnesota. His research uses interdisciplinary modeling to guide science-based policy. His current work concentrates on the optimal ways of mitigating risks resulting from emerging infectious diseases and from climate change. He also works on incorporating ecosystem services in economic models and on applications of economics principles to ecology. Please show, also we have a gift for you. It's this beautiful W lab, that's this building. Bless.
Thank you so much.
Yes, thanks for being here.
Really appreciate it. Wow, thank you. Thank you for this wonderful introduction. Should have really sound safe. And thanks to Rachel and Lisa for making this possible. This is fantastic. It's really been like home in Minnesota. I was studying making the master economy on my PhD thesis was in economics between 1990 and 1995. This building didn't exist a lot of this time when the weather was ready. So it's great to be back. So I'll be talking today about some connections and where things can hopefully between economics and health related to pandemics. A little bit about myself. My work concentrates on modeling persistent services, valuing contributions to well-being, human well-being that are not captured by traditional economic indices. I also work on climate pollution and human health, productivity, the effects of both climate but also PM2.5 concentrations on labor productivity. And the reason I was visiting for the last 2 weeks is visiting with the economists, the other campus, the Sample campus, Skipolaski's lab, where they're studying the social cost of deforestation. And I want to actually into the social cost of carbon, which I heard about, and I was talking to them about incorporating possibilities of that I could increase livelihood of miles lower in calculating this cost, which is something that I'm also a member of the Lancet Commission. You can see some of our goals there on the prevention of violence spillover. But my main goal as being the only economist in this commission is to convince health and ecologists, specialists that arguments are not evil. I am I'm not succeeding. Okay? I'm just a long devil's advocate view. So you'll see something about that today. So right. So I'm talking about the economics of emerging infectious diseases as a developing field, and really I'm making this up as a field. This doesn't really exist as such. Yeah, it's of course related to fields like health economics, bioeconometrics, and of course epidemiology. But it's distinct. It emphasizes the role of incentives and optimization. And in terms of methodology, and I won't be talking about methodology today, but just to throw that in, for the more model-oriented people in the audience, there will be something called optimal control theory, and also game theory and mechanism, that's called mechanism design, policy design, that respects individual incentives. So this will be, and this is a major difference between my public health friends, the commission and elsewhere, and economists. Economists are very cynical people. We don't think that people will do what is the right thing, even if there is an obvious socially right thing to do that stares you in the face. We don't think that people will go there unless they have the incentives. So we within that policies ought to be designed in order to, if you want people to do the right thing, that you make it through arranging rewards and penalties, that it becomes the best incentive to do the right thing. So that's a major difference, and this will sort of come out in some discussions. Now, when it comes to pandemics, there is a view out there, obviously, in this audience, but maybe in the public, maybe even among us members, that these are exogenous events. Obviously, they affect a lot of people. They are aggregate, what it comes called negative aggregate shocks. But they're exogenous, right? They don't have anything to do with what we do. They're like earthquakes or asteroid hitting. They just happen from time to time. It's unfortunate, but there's nothing we can do about it. We can do things after they emerge. Epidemiology, which is a lot about that. But actually, what the frequency, expected frequency, probability, and expected frequency actually depends on human actions. And this is the first part of our talk today. We'll be talking a little bit about that. And the emergence of disease like COVID-19 most recently. And I'm talking about COVID-19 just most recently because it's very high. But it was a matter of time, and so is the next one. You know what to say about this. So in today's talk, I'll divide it into two parts, and I hope I'll be able to go through both. Please stop me, by the way, I should say, anytime, to ask questions, clarifying or otherwise. If it might take me too long to answer, I might leave it toward the end, but please don't hesitate to stop it. Something is unclear. And by the way, everybody can hear me okay? Okay, good, thank you. So the first part will be more upstream, talking about costs and benefits of prevention in terms of hopefully reducing frequency of pandemic emergence. And our mission in that Lancet committee is mainly about that. There are other committees that look at more downstream issues. And then the second part will be closer to epidemiology, but with an economics twist. And I'm talking about policy during a pandemic. I will present findings, but only very briefly mention methods. And again, if you're interested in methods, we can talk about this later. So let's start with the first part, pandemic prevention. This will be based in two papers written by interdisciplinary teams. And by the way, this is my first talk ever, so I'm a bit nervous in the epidemiology group. I'm used to give talks to economics audience, and also more recently I've worked a lot and I've really enjoyed with infectious disease ecologists, but never really addressed an epidemiology group. So this is going to be exactly. That's not especially in seminars, posted in economics. Yeah, so first analysis would be the first part of the talk will be based in this two papers that were published in Science and Science Advances recently. As I mentioned, the COVID-19 pandemic is not unique. Wildlife is a hotbed for virus evolution, and as we increase the wildlife-human interface, there's a high probability of spillover of some of these viruses. 58% of human pathogens are zoonotic, passing from animals to humans. About 75% of the emerging pathogens are zoonotic. So a lot to be concerned about here. Here are some recent examples. And the path, let's look at SARS-CoV-2 from or maybe MERS-CoV or SARS-CoV. I mean, you'll see it's very similar from a bat to a mammal. In the case of SARS-CoV-2, not exactly identified yet. Most likely some kind of a wildlife market, but we haven't identified the mammal yet. To humans, and then even sufficient evolution of the pathogen, the worst case scenario, human transmission. It's kind of limited, as fortunately with the case in the case of MERS, because it's a very deadly pathogen, but it can also be nobody has to solve with SARS-CoV-2. Now, in each step, this is fluoride and all have written in a paper, Nature Reviews Microbiology. They call it a Swiss cheese model. So basically, imagine Swiss cheese that is holds in different places, but imagine this whole moving around. And at each level, the virus passes and at least, and it needs to find a hole in order to get to the next part. So it's a probabilistic process. Most of the time, it won't find a hole all the way, and it will stop at some point, and then we go like. But there will be time, and we're writing a partial differential equation model now. That process. There will be times when, given the characteristics of the pathogen and its evolution, it will find all the way through to human infection. And this is really what we're worried about. Something I was reading today, not exactly having is made into seals. And 96% of the seals that have died as a result of that virus. That's now you notice a lot of this starts with bats. So let's kill all the bats. Believe it or not, this is a view that I've heard. Bats are incredibly useful, of course, part of the ecosystem. But what happens more and more is that we see that these are people again, on our work. But you know, this final still green areas and the darker green area, darker green, brown areas. So this is one of the green patches. This is not something that has been actually quite answered yet, but at least intersection in the forested area. So the humans entering that area, it's not going to happen in areas that are. It's not going to happen in areas that are totally deforested. It's a good investment. When I was teaching MBAs, I got this and then. That's what you remember from the talk. So areas that where there's no wilderness, you're not going to have emergence. Areas where there are no humans, you're not going to have emergence. It's going to be somewhere on the boundary. So there is something to be said about this. So increased human wildlife interface as a result of among other things, agriculture in the areas that are transformed from wild forest typically they become agricultural land. Deforestation, habit fragmentation, also wildlife trade. You add to that increased connectivity variation, where anybody who is infected can be anywhere else in the world within 24 hours, you get increased pandemic frequency. So this is something that we might have to actually worry about increasing. So these are some of the pathogens. So we could use this list in the second paper because we sort of calibrated the probability distribution of these things emerging. And COVID-19 is still open, of course. 7 million more already around the globe, and still going. Things like, of course, Spanish influenza, the Spanish flu stands out as an event, and this is an estimate of how many people were killed at the time. This was not a where records were kept, especially outside of Western Europe and North America as well around the world. But also the population of the Earth was much smaller at the time. So this was a tremendously large event. And of course, another zoonotic disease that we shouldn't forget is HIV. In fact, I used to think naively that the worst case pathogen is something like Ebola. Like something that kills very fast, very high football. Well, no. Worst guys know this stuff. The worst kind of pathogen is a pathogen that is only deadly and it takes a very long time to heal. So you have a lot of time. In the case of HIV, close to a decade, in cases, but you can have many years where you can go around without even knowing you're infecting other people and the disease until, of course, now it's on the virus. Job, but until those were discovered, that the disease was almost even. So, from the economics point of view, we will need to, and I have clean with this right away, a way to monetize these deaths. And in fact, in particular for HIV, something interesting happened. When economies, 33 million people died within a day, no, I'm sorry, a year, or maybe 2 years, or maybe 3 years, like that's much worse than having been dying over several decades. Because it affects, when you think of economic costs, the deaths are very much spread around those times. To a public health person, a death is a death is a death. But when economies spread out, if we happen to have the deaths, we prefer them to be spread out across time because this affects adversely the economy less. So when we calculate the costs from deaths, we want to monetize that. We use a concept that is called value of statistical life. Some of you might be familiar with it, some of you not. This is something I can talk about at the end. But there is a way that is actually not just by economists, but by the Environmental Protection Agency, several agencies in the US that need to evaluate and monetize the value of human life. So this is something that, some of you might find objectionable. I can talk a lot about more about this, but I don't want to talk to you about this. Now, what we do, what we do is, in the first two papers, we do a cost-benefit analysis, consider several scenarios, but in our benchmark, we assume that a COVID-like illness of that severity emerges, we think conservatively about once in 100 years. And of course, even if you don't count HIV and you look at Spanish flu and COVID, that's relative range. We found that prevention measures, and I'll tell you what these measures are, that we recommend, result in net benefits. They reduce the probability by 1/3. And in fact, significantly less if we take into account climate change benefits and co-benefits rather from the use of deforestation. Almost certainly, this is a conservative analysis. This was carried out in 2020. There have been a lot of deaths, a lot of so here, this is not ours actually, but a reporter of the Guardian created this nice graph to summarize our paper. So what you see on the left, there are two squares that look like they are equal size. They are meant to be this way, but actually the square on the right, the actual size is this. So there are about 420, 430 of these red squares in this square. This is the units here are dollars, trillions of dollars. So what you see on the left, when we start with that, is the total cost of the coronavirus to the world's well-being, as we measured in that paper. And that includes two main parts. Mortality costs, monetized because the units are dollars here. So turn human lives into dollars. That's the way to do cost-benefit analysis. So I'll stay in. But you have lives on the one hand, dollars on the other, cost and benefits. How do you make the comparison? Right? So that's one perfect way of doing this. And again, this was a notion of values and enters, that I talk about at the end. But there is a way, there is a method that monetizes mortality costs, and we add that to lost GDP. And this is the total cost, which is really gross underestimated, if I may. But I'm not letting people start in 2020, and there are many things within. So this actually makes our case strong. On the right-hand side, you have potential policies it's actually, to be fair, it's not comparing this, that's, but this will be once in 100 years. So deciding on paying this once in 100 years, the whole economy, in terms of 100, now COVID-19, that's 30. But this will be paid every year. So you have to add that into a net present value calculation. So there is a little bit more to go. So it's not comparing that. But as I said, there are over 400 of this in the little red one, the purple one. So there's a big difference. So what are some of the measures? And we look at the relative effectiveness, but also the relative costs. So the measures we consider in that paper is to reduce the spillover from wildlife. It's concentrated on livestock, which is one main avenue for which zoonotic disease can spread in humans. Monitoring wildlife trade to the extent that it occurs. Anything wildlife meat trade in China. There are many challenges there, and I'll talk very briefly about that. Early disease detection and control. So the relative size of this is the relative costs associated with this prevention measures that you see here. And this is reducing tropical deforestation by 40% in most critical regions. So we don't have a direct estimate of how much this measures by how much they're going to reduce the probability of zoonotic spillover. This is something we're working on. It's really, really hard to do. But what we're saying is that given these costs, if the reduction is 1/3 or greater, in fact, it's less than that if you consider the co-benefits of stations, sports, and states, then it's worth it. Now, what do I mean by cost? I can go very fast. I don't have to convince you that when it comes to GDP, gross domestic product, is the value of goods and services produced in the economy. The COVID was a devastating event. In fact, something that is very often ignored is the equity element of this. If you look at recovery from COVID, and this from the World Bank Group publication, if you look at recovery, and if you look at how the richest countries recover, so this is 2019, 2020, 21, 22, right? So you see the wealthier countries recovering very nicely, although they did suffer earlier on. But look at what happens to the countries that are, in terms of the poorest or the second poorest around the world. The recovery is much slower. So there is an equity consideration, even if one takes the side access to vaccines, healthcare, and so on, in the world's poorest nations, developing countries. In terms of economic recovery from the crisis, COVID-like crisis, there is a big difference as well. Now, what are some of the challenges? Banning wildlife trade is very difficult. There are social norms associated with some of these activities. We don't want a brown trade to emerge. Then we have no control on what's going on whatsoever. It could end up harming biodiversity. Best to regulate and educate over alternatives. It's also worth mentioning that developed countries are also responsible in some ways demand for fur and exotic pets in developed countries also plays a role here. So it's not just wildlife markets. The U.S. spends trillions of dollars in health, 4.5 trillion in 2022. You guys know it's better than I do. But really, very little is developed in public health and especially prevention. The amount that we've driven for decades. We think that here there's another equity consideration. This is part of what we're starting the last committee. Who will pay for this cost globally? The global north suffers the consequences of a pandemic in spillover as much as the global south, and they have the ability to actually put these resources in place in order to reduce that frequency. So there are some negative considerations in regards to good pace internationally. But despite our best efforts, a new pandemic, a new pathogen, COVID-19 constantly could emerge. So we need a global plan to identify local viruses, test the capacity to infect human cells, raise the red flag when we see something worrisome. This veterinarians, for example, increased number of veterinarians in critical spots, and explore early with all else fails. Two open research questions from the first part before I move to the second part. These are things that I'm working on, and we'll do this part on that answers. Quantify the increasing likelihood of zoonotic spillovers and functional deforestation biodiversity changes. Ideally, you would like to know for each additional acre of deforestation, by how much are we increasing the life of this increased human wildlife interface. We don't have any evidence. The second is primary pandemic prevention, which is something we emphasize, versus something that is more traditionally emphasized in public health fields, including environmental, which is post-spillover preparedness and response. So this is what I was talking about earlier on. So these are not like earthquakes. Human activity has something to do with the probability of spillover. The prevailing view in public health, you guys correct me if I'm wrong, but that's our feeling, at least in the commission, is that what prevails more is the preparedness and response. Let's watch and respond fast when things emerge. Well, we say it pays off to actually look one step or one more step upstream and actually affect, reduce significantly possibly the probability of that speed. We're talking about in the we should come out this one next week. Last opinion piece about in fact the recent WHO pandemic accord draft that we really think emphasize the preparedness and response at the cost of infection. But this is something to be discussed and I'd love to hear reviews. So I will move, I'm going to send the questions to the second part now, which is after pandemic emergence, and make more of a connection to our epidemiology, development models, and tell you what the econ is. Okay, so traditional things that we're interested in, once we have, now we lost, so we are, prevention is not the issue now, we're dealing with the problem. How fast this spread, what policy restrictions can mitigate contagion. Now, restrictions may also harm economic activity. Is there an economy versus health trade-off? So getting somewhat more controversial. So we saw two views, and of course, I think that most people have thought of somewhere in between, but for the sake of the argument, I will present them as two extreme views because it's easier to make the comparison. One view is that really there's no trade-offs between the economy and public health when we take measures. Think of the COVID crisis, I think. Why isn't there no trade-offs? Well, because we have restrictions on mobility, lockdowns, and so on, that will bring infections and deaths down. So they also have the economy recovered. So it's a win-win. I would call this an extreme public health focus. And then there's, let's call that the extreme economics review. I think, again, most scholars have really viewed somewhere in between. That there is a trade-off resulting from restricting economic activity in order to reduce disease transmission. And in fact, some of these costs are far-reaching, and it's not just losing income. Okay? Issues related to mental health, domestic abuse, education, that was a big one, but also preventing another healthcare. All of these actually incur costs. And this translates to economic well-being, human well-being costs once you have things like lockdown. Now, what the economy says is that to the extent that there is a trade-off, we should explore it optimally. So the way the economy sees this picture is that it's as if we have two objectives. Objective one is minimize deaths. Objective 2 is minimize effects to the economy. And the fact that there's a trade-off translates to the fact that you have a frontier where you can choose, what you don't want to be is in something like the blue pole, because then you're not optimized enough. Then you can reduce what you can do better in terms of what objectives. So a policy that is not in the blue pole, the schematic is going to be inefficient. People say, why I can do by moving your face, I can do better in terms of what objectives. But once you are in the frontier, the economist says you can only do better, you can only do better in the public health dimension by hurting more the economy. And of course, where you on the frontier, that's not for the economy to decide. That's for the economy, the people who live in the society to decide. For example, there will be some societies that value economic performance more than seeing some of their fellow citizens die. And it sounds terrible, but we did see that in the US states. Well, maybe not many, but certainly some. There might be other societies that are a lot more conservative and they're willing to take a lot more economic losses. Okay, so that's not, we need a parameter to parameterize a frontier, but the economist's job is to bring us to the frontier. Okay, so let me
Yeah, please. To be fair, going back to your equity point, there's really not one red line, right? Aren't there multiple red lines based on where people are economically? Like, would that red line look different with someone?
Absolutely. This red line, this frontier will look very different if you are in global south and the global north country.
That's a population average.
Totally. So think of this as being fixing, let's say, the US in the state of Minnesota. So this is the frontier for the state of Minnesota. Although states are not, we all live in a swimming pool, right? So it's not like one corner of the swimming pool is isolated. Of course, the rest of the swimming pool. Some graphic examples that we put in the press about how things are spread in that sense, not isolated. But yeah, you're absolutely right. That frontier is a very schematic picture that is context dependent. Very good. Yes. Now, at least what I know as part of epidemiological modeling is the SIR. So I'm assuming everybody here is approximately more familiar with this than I am, but please correct me if not. Relevant parameters that are the rate at which susceptible individuals get infected, the rate at which they infected recover or die, and you can study dynamics like causing some, for example, policy scenarios. Now, where the economist comes in is with the second bullet. The SR model doesn't typically consider choices or incentives. Individuals are treated almost like particles that can bump into each other under certain circumstances might prevent them, but they don't make choices. They're like, in society, individuals actually make choices. They might pursue certain interactions, avoid others, they might change behavior, and that's an important one. As a result of incentives, individuals might change their behavior. They might bypass rules, for example, if the consequences are not severe. And these choices, again, coming from the economist perspective, are things that ought to be modeled. There might be modeled in an economic sense, which is things that agents optimize in a selfish way. There might be modeled in a behavioral sense, but they need to be modeled, we argue. Right? I'm happy to debate that. So, what are some of the decision making that might take place? Well, decision makers might include the national policymakers. You might think that the level state governor, to find one, let me know, who cares about the well-being, not about re-election, but about the well-being of the society. Okay, the tool here would be optimal control here. You might have strategic policymakers. You might have multiple state governors that want to do the best for their state, but at the same time, they prefer the economies to be harmed through some costly measures. They prefer the other states the other governors are doing it. Okay, so they're more strategic considerations on all policy. Like the individuals in the society, and the two here, some people mutual gains. So what epi-econ models do is they combine SIR modeling with economic model that considers incentives, to evaluate trade-offs and design policy. So I have one technical slide for the sort of math-oriented people in the room. And if it doesn't help, please ignore it. The SIR model as a dynamical system is something like this. We have a vector of, distribution of the population, let's say across susceptible, infected, recovered, and that then we have on the right-hand side the vector field that tells us how this changes over time. Right? So it's a dynamical system, and that dynamical system is going to give us the evolution of how the pathogen spreads. For example, how the fraction of infected in the population changes over time. SAR models are of this sort of mathematically, they are in this class. What economic models bring is optimization. So what the economic model is going to do, and this goes under the title epi-econ because we combine SIR with economic optimization, is that we have an objective that we explicitly optimize. That would be minimizing a combination, for example, of adverse effects to public health and to the economy. That objective is a function. And then we have a policy variable, and then the dynamical system is a constraint. So this is called optimal control theory, where you study how to optimize the functional, like this integral, over time, from 0 to t, that's considered to be the time frame of the pathogen, right? And it's like in the time. And this is going to give you how, let's say, susceptible or affected or recovered people are going to vary over time as a result of the existing state, but also policy. Why is there policy there? So we choose with respect to that. So mathematically, and I'm going to come to that. It's a very different beast to study an alpha control problem versus a dynamical system, because here the optimization across policies is explicit. Now, optimal control problems have been studied in epidemiology very early on. We found some early, so we're not the first to do it. But mainly by applied math operations research people, I don't think they ever really took on as mainstream epidemiological models. But that's something I would love to do more about. So, in that regard, let me in the last 10 minutes, if I may, let me present this paper. It's the last one that came out earlier this year, where we actually look at an SIR like model. Look at a model at the early pandemic stages when we don't want to tools are lockdown, and testing and isolation. So this is early on in the pandemic prior to any medications or other methods being developed. And we optimize taking into account both economic and health objectives. So what we find in case around is that both economic damages and mortality are reduced relative to the laissez-faire because the lockdown is put in place quickly. So something like the Swedish sort of response to COVID is not something that's consistent with optimality. So even if you consider economic objectives, if you are comparing just status quo doing nothing versus a strict lockdown, and in fact, the stricter it is, the better it's going to work. So that's finding number one. But finding number two is that if there is effective contract testing, that actually is going to dominate as soon as viable tests, of course, are available, and they might not be readily available depending on the package. But that is actually dominating lockdown policies. So this is what we are finding out. These are not new, but they are new in a setup that considers both economic and epidemiological objectives, right? So yeah, so we'll talk about how these are derived and tell a little bit about the model. Flexible, a model is very flexible, can accommodate extensions like wearing masks, capacity constraints on the health system and so on, but we don't do that at this point. So here is, if I may, little bit more of a description is an expanded SEIR model. We consider two classes of exposed, these types of exposed, and two classes of infectious individuals. So there are four classes, E1, E2, I1, and I2, in addition to recovered, and actually there will be another one, susceptible. E1 are exposed ones who are not yet infectious. And E2, they are obviously asymptomatic and they're not infectious. E2 are also asymptomatic, but they are contagious, they can infect. So in E1, individuals are going to transform into E2 at some exponential rate time. Now, pre-symptomatic cross E2 transition into symptomatic I1 at some rate by 2. And notice both E2 notice that both E2 and I1 are infectious. And if I2 is large, expose also frequently unexpected symptoms, so you're going to be able to identify them, how to isolate them fast. Here you can distinguish, for example, SARS, COVID-19 versus the other extreme HIV. Infected hosts now are also divided into classes. I1 may be sick, maybe unsick and hospitalized, and this is COVID-19. We assume that I2 hosts have a high mortality rate than I1 hosts, but we assume that they are isolated and are unable to infect. A change of assumption. But after I2, you are seriously sick. Chances of dying are unfortunately much higher, but we set the chances of infecting someone to zero because we assume that these people are hospitalized and under isolation. Another class we introduced is C. We're trying to look a little bit at the English model. And see our context of infectious hosts who will not develop an infection. So you don't know, of course, you can trace whether someone is a contact, and this contact could be infectious. But you don't know. You know that they're contacts, so this might be a category that you want to pay particular attention to. For example, it can be tests, you want to maybe test them, maybe you want to isolate them. All of these concepts are going to emerge optimally. But certainly you can identify costly testing and we consider the cost of actual testing. And here's another going back to your point about equity. The cost of the COVID test is a very different thing in terms of as a fraction of per capita income in a country like the US or in a country in sub-Saharan Africa. So testing is another way to consider this lower inequities. But testing can differentiate between uninfected, C, and exposed, E1 and 2. But otherwise, we know that this is one class that becomes contact. Therefore, they could be infected and only testing can distinguish. We assume here for simplicity that tests are 100%. So this is a little bit like a schematic picture. So we have susceptible, containing to the first exposed or the second exposed form. C are the contacts that are not infected actually, so you can distinguish between these three unpleasant tests. Some of these people are going to be infected, some of them are going to pass into the seriously ill, and then some of them unfortunately will pass away, others of them will recover. So what are some possible policies here? We consider who and for how long we're going to do the lockdown, who and for how long we're going to test. And policies are solutions for not control problem. So we maximize the achievement and we will not show the objective subject to the constraint. So this is the objective. It's a combination of economic well-being through output produce, that's this part. And this is avoiding deaths, let's say this utility of deaths to the economy. And we want this touching at the highest time possible, subject to economic constraints. For example, you have output that is produced, and that output involves only people who are in isolation. If we're in a lockdown, the fraction of people who are in a lockdown, PT, and again, PT will be determined ultimately to maximize that problem, that value. those people cannot produce. So you're producing, the people who are producing output are those who are not in lockdown, right? So this allows you to consider the trade-off. The lockdown reduces transmission, but also reduces production. And you find the optimal solution to this problem. Then there is a problem that values where you are in that frontier line. Is this society valuing, if it's one, you value lives and economic activity in the same way, otherwise you discount. That's something I can talk about later. And these are, I don't go over this one, but I want to show you, these are the analog of the SIR differential equation. So we have a system now that has 1, 2, 3, 4, 5, 6, 7 differential equations. These are ordinary equations. So it's, I need to introduce ages. So we got partial differential equations. So it's going to be a much harder problem. But even so, this was not an easy problem to understand. I just want to give you the flavor. I know I'm running out of time, but let me spend the last 2 minutes with some flavor of the results. This is what happens to the economy in status quo. And this is a pathogen that gives you the different colors. I hope you can see this. Corresponds to a pathogen that gives you immunity for 6 months, and then you can see it again. Versus 1 year, versus 2 years, versus 3 years. And you can see what happens. This is the economic cost. You see what happens to production. This is what happens to production. So economic activity. So you see a big deep, but then as people in the sector, as people recover, then you can see again, and so on, depending on the pathogens in the lab. This is what happens. Deaths. Again, I can go over this and hospitalized, and go over this in some more detail, but in the interest of time, I just want to give you a flavor of what we're getting, and because we can get to there. These are their lockdowns. And this is where the lockdown is implemented with a 2-week delay, it's a week column versus 4 week versus 8 week versus 16-week delay. And again, you see what happens to the economy here versus what happens to the, for example, the trash for people that are hospitalized. So a lockdown that is swiftly put in place, and see it does better both for the in terms of the hospitalizations. In fact, the black curve here is the lesser fair. So if you're going to wait for 16 weeks, you're very close to only causing to stay in the first place. This is very close to the lesser fair. So swift action, and remember, and that's an important thing, so I will go back to it. The length and the depth of the lockdown are determined optimally. We are not coming and saying, well, why is the lockdown this deep versus this deep versus this deep? Only if it lasted this long versus this long. These are not arbitrary assumptions that GPS are going. This is what the optimization problem comes out from this optimal control problem. I want to emphasize that these are the optimal level of lockdowns in the objectives. The last thing I will show you, we look at random testing versus targeted testing. These are the testing rates. But one thing that you will notice with observation is that when it comes to testing and isolating versus lockdowns, if you compare the effects, for example, on if you compare the effect on both production and hospitalization, this graph with the previous page, you will see that actually, when it comes to hospitalizations, the test and isolate is not going to do as well as the lockdown, especially if the lockdown is. However, testing and isolating is going to be much better in terms of the economic objective. So if you put the two together and you do the optimization, you find that actually it's a much more complete strategy to test and isolate that to impose lockdown. So if the lockdowns are implemented early on, they're also very effective. But again, the new thing here is that both objectives of the economy and the epidemiological objectives are considered. So in summary, hope I didn't go too fast over the last part, but I can go back to any of these. Best doing that on time. Tax your patience for that. We face global challenges related to disparate solutions. The empathy experience was both global and unfortunately, we didn't know that it's certain more native. And people are looking for within the national boundaries, but pandemics, part of these things, like looking at your own national boundaries, it's a little bit like looking at your own color in the swimming pool, once you kind of know better than anyone. But of course, we also need in the disciplinary perspective, we think that the economics perspective adds something here, but this is something for discussion. Economic modeling, we think would be helpful with designing policies to both upstream reduce frequency of runoff spillovers and also downstream respond to pandemics in effective ways. And very much look forward to future collaborations between economics and public health fields. I'm very happy to discuss with any of you comments, suggestions, hear about your projects and so on. So thank you again for your patience.